There have always been really good pockets of really excellent care, and we do a lot of things incredibly well. We have some fantastic people delivering some fantastic care throughout the 3 hospitals. We now have a vast array of technology available to us that we're not using properly yet. We already in the Trust have started to use small bits of information technology on smartphones to improve our communication with each other, to improve our handover of patients. But we can do an awful lot more. We can start to join up not just people in the hospital, but also GPs, community hospital, health and social care. The way in which we've started to do things has changed massively, and if you carry on in surgery, then there's the use of robotic surgery, which has come in recently.
This is really high-tech surgery that we are now offering in East Kent. Robotic surgery is state-of-the-art, futuristic surgery. What it means to the patients is a real benefit in terms of their recovery, a much shorter hospital stay, and their overall recovery, their return to work, their return to normal daily activities is now a lot quicker compared to open surgery. This is one of only 5 centres in the country for robotic surgical training, and we're able to run our fellowships out of that, and we will then get a lot of trainees coming to our service to see and learn from us and what we do.
All of the gynecological cancers from the whole of the Trust come up to Margate for surgery. When the National Cancer Intelligence Network started publishing figures on minimal access or laparoscopic surgery for uterine cancer back in 2007, we had 4% of our patients with endometrial cancer were having laparoscopic surgery, all the rest were having laparotomies. We now would do over 90% laparoscopically, so we've gone from being an outlier on the wrong end of the curve to one of the outliers on the other end.
It's really important for us to attract good quality staff here. All of us have something valuable to offer that particular patient and their family, and that's what we do, and we'll strive to do that more and more as we go forward.
We've made some real progress on a number of services, some developments around stroke, some developments around the vascular services, and the thing that connects all of those together is how we're trying to work a bit more across the whole of Kent and Medway.
So Medway is really excited to be forging this partnership with East Kent, and although we're starting with vascular services, I think that by creating that network it really does open up more opportunity for us. You know, Kent needs to work as a system. We're an important player in it, as is East Kent, and we know we can do better together.
We now have designated stroke units which we operate over 3 sites, the William Harvey, Kent and Canterbury and KEHUFT. The changes in outcome for patients who suffered a stroke has been dramatic over the last decade. The mortality, chance of death within 30 days has reduced by 40% over the last 10 years. The therapists, nurses and doctors work together to provide a really rapid diagnosis. Getting the right diagnosis and then working out exactly which treatment to give can vastly alter the outcomes.
I knew in an instant, I knew what had happened. I'd had a full-blown stroke. My husband did all the right things. He called the ambulance, who were there. In moments they arrived. And when I was in the treatment room, when I saw Dr. Hargroves looking at the computer screen, seeing my brain there, and I knew I was going to be okay. By 3 o'clock that afternoon, I was sitting up. By 5 o'clock, I was walking unaided. I was discharged at 2:30 the next day. The emergency service that I got is absolutely fantastic.
There's some fantastic stuff going on in terms of clinical service, and a real enthusiasm from staff for getting on board and developing those even further.
We treat patients within an ambulatory setup, all right, that does not warrant an acute admission.
We have an elective service, so we see patients who have long-term conditions, and we also run an emergency ambulatory care service.
Having a collaborative approach is bringing together different disciplines, you know, working as one interdependent team. It does improve patient flow and outcomes.
So everyone knows their role and you get the job done efficiently and provide high quality patient care, which is, I think, what it's all about.
The national figure for mortality for emergency laparotomy was around 12% at the beginning of 2014. At the William Harvey, we've now managed to reduce the risk-adjusted mortality rate down to 6%, which is in line with the rate that's also at QEQM. The way we've done that is to institute a pathway called the emergency laparotomy pathway. If you can demonstrate that together as a team you can reduce this group of patients' mortality, people want to be involved in that.
It's really important for us to attract good quality staff here. They're the ones looking after the patients all of the time. They know best what people need.
Clearly, our first and most important priority is providing the best possible healthcare we can to our patients that we serve. You can only do that if you've got great people doing that, and so we absolutely need to support and grow the people we have already, but we also need to add to that with great people who are coming in from outside to join us.